Let's talk a little bit about surgical tourism and what are the costs and real consequences of having surgery abroad. Now, I know a fair amount about this topic because I do a lot of revision breast surgery. Not just breast surgery. Let's talk a little bit about surgical tourism and what are the real costs and consequences of having surgery abroad. Now, I know a little bit about this topic because I do a lot of revision surgery and I see quite a bit of patients that have gone abroad to have surgery and they're coming back with issues and complications. Now, don't get me wrong. I think there are many well-trained and qualified surgeons all over the world. So just going abroad to have surgery is not necessarily a bad thing as long as you do your research, really find out the qualifications of the surgeon, where you're going, as you would here in the States. Read reviews, talk to former patients, really do your homework. I think the problem is going abroad and then coming back in a short period of time. For example, especially when patients are going to get big surgeries like mommy makeovers, tummy tucks, liposuction, breast lifts, and they only stay locally where they had the surgery for a few days or a week and then they travel back. I think that's where they run into issues. Traveling too early and then getting problems such as fluid collections, seromas, bleeding, infections. Those are very common things that I see. Also, when patients go abroad, obviously, many times it's for monetary purposes. It's cheaper to get surgery abroad. Sometimes cheap ends up costing you way more because if something is cheap, it's for a reason. And that's when I hear stories from my patients, things like, well, I went abroad and the surgeon had 10 surgeries that day. I was his 10th surgery. Things were rushed. This thing happened. The other thing happened. And then I flew back a week later. I still had drains in. I've heard all sorts of stories. Now, when you're planning surgery, it's important to really maximize the situation so that you can recover properly, you can have proper care, and you can have access to your surgeon if there are minor issues. Now, I have patients who fly in from out of state and out of the country to have surgery with me here in California. And when I do, we plan it so that the patient can be local for at least up to 2 weeks so that they can be proper follow-up, proper care, and then deal with issues when they show up. Because there's issues will happen. A suture will spit, an incision can open up, there can be a minor infection. All of these things, if managed quickly and in a timely fashion, don't end up being a problem. But if you're not around and you don't have access to your operating surgeon, then that could be a real issue because then you have to find another surgeon. And sometimes we could be reluctant to dealing with the complications of another surgeon. But I see it all the time and I have to manage complications from other countries. So while surgical tourism and going abroad for surgery is not necessarily in and of itself a bad thing, as long as you do your homework and do your research, it is important to realize that when you go abroad, you don't have sometimes the same certifications or safety controls that we have here in the States, and that can lead to negative outcomes in some cases. So buyer beware. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.